Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, viral corneal ulcer. Viral corneal ulcer is most commonly caused by the herpes simplex virus followed by herpes zoster virus. It is most commonly caused first by herpes simplex virus followed by herpes zoster virus. Even in the viral corneal ulcer, the symptoms these symptoms are similar like that of bacterial corneal ulcer, like watering, photophobia, redness, pain, mild discharge, and diminution of the vision are common in viral corneal ulcer also. And along with these symptoms, in the viral corneal ulcer, it is associated with the decreased corneal sensations. Then here there is a dendritic ulcer can be seen in the patients, and the ulcer bled in the dendritic ulcer bed can be stained with fluorescent. So the ulcer bed can be stained with a fluorescent stain. With the help of fluorescent stain, the ulcer bed can be drained, whereas whenever there is a margin of the ulcer has virus laden cells and is stained by the rose bengal stain. So if you see, we have two parts in an ulcer, right? So if this is the cornea and this is the ulcer, the bed of the ulcer, this is stained by fluorescent stain, okay, whereas here on the margins of the ulcers, here we have virus laden cells are seen, which is stained by rose bengal stain. Then sometimes in the viral ulcers, this dendritic ulcer is mainly occurs due to the involvement of epithelium. Epithelial involvement will result in dendritic ulcers. Then we also have one more, which is involvement of stroma. Whenever there is stromal involvement, this stromal involvement can occurs mainly due to the direct invasion occurs, and then there is destruction of stroma can occur. As a result, the stroma gets destroyed and the stroma becomes cheesy and necrotic with associated uveitis. So the stroma becomes cheesy, necrotic appearance is seen with associated uveitis is seen in stromal involvement. Then the patient can also develop interstitial keratitis. In interstitial keratitis, the patient develops hypersensitivity reaction to the virus, and even salmon patch is seen in interstitial keratitis. Then there is involvement of endothelium. In the involvement of endothelium, the patient develops disciform ulcer can be developed in the patient. Then there is trophic ulcer is also seen, and this trophic ulcer is also called as metaherpetic keratitis. This trophic ulcer or metaherpetic keratitis mainly develops due to the denervation, and drug toxicity will result in trophic ulcer and metaherpetic keratitis. Then the diagnosis of a viral keratitis. The diagnosis of a viral keratitis is done with the help of a PCR. Then for the treatment depends upon the type or the involvement of the things in keratitis. Actually, if epithelium is involved, we can just give topical acyclovir is sufficient. If interstitial and disciform keratitis is seen, for interstitial and disciform keratitis, topical steroids are given to the patient. For trophic keratitis, we should stop the causative agents and lubricants are given for it. And in epithelial keratitis, steroids are contraindicated. One important thing is, for interstitial and disciform keratitis, steroids are given, but for epithelial keratitis, steroids are contraindicated. So this is the herpes simplex viral corneal ulcer. Here the corneal ulcer is seen along with the dendrites. These are the dendrites which are seen.
Thank you and thank you for watching.